Hello, it's Uncharted here presenting MediFlow, a composable confidential health record system powered by Zama's FHEVM. To understand how critical a problem this solves for Africa as a continent, let's take a look at first. In late September 2025, the backend breach on Morocco's digital pharmaceutical platform, known as Pharmacy.ma, led to exploit of over 41,000 medical user-sensitive information, prescriptions and personal health context, increasing risk of harm, identity theft, phishing, and targeting scams. Then Kenya's digital health platform Mtiba suffered a significant cyber attack in late 2025 when Kenyan citizen data were being sold for $9,000 on Telegram, which could have been totally prevented if they had utilized MediFlow powered by Zama's FHE encryption, because the hackers would see practically nothing but 2.1 terabyte of stolen, randomized, and mathematically unbreakable strings of ciphertext, which is essentially useless without the right decryption keys, of course. The core problem is structural. African hospitals run on legacy systems. Patients' record, even when digital at all, sit in unencrypted databases scattered across multiple systems. MediFlow solves this by allowing patients store encrypted health attributes on-chain using fully homomorphic encryption. Hospitals can run eligibility checks without seeing raw data. When an insurance provider runs eligibility checks on patients, the result, a yes or no encrypted boolean, is stored on-chain. The InsuranceModule contracts can read this result and trigger a payment automatically. No insurer saw that patient's risk score. The smart contract computed on encrypted data and executed automatically. Then we have the delegated decryption, the regulator feature. Regulatory bodies can compel disclosure under specific legal conditions. MediFlow implements Zama Delegated Decryption primitive to handle exactly this scenario. A pharmaceutical company can now ask what percentage of Nigerian patients on drug X had cardiac events and receive the answer from a dataset of thousands of patients whose individual records were never decrypted by anyone. This is the missing primitive for African clinical research, not blockchain for the sake of blockchain, but FHE enabling research that was structurally impossible before without privacy violation. Thank you very much, and feel free to reach out to our team for integrations or follow the guide on our GitHub. Links are below. Thank you.